Dr. Lavan here again, guys. I'm here with my colleague Rachel. She's a lovely physician associate, which we're going to talk about more in a few videos' time. But today it's in with a different hat. She's actually a physiotherapist by trade, and I thought she'd be the best person to maybe talk about some musculoskeletal problems. Now, remember, musculoskeletal involves muscles and bones. And we thought maybe certain common conditions that patients come to see us about, maybe we could get an expert opinion from Rachel on how to manage it and maybe what are the do's and don'ts. So Rachel, do you mind if we maybe talk about a few topics? And remember guys, we'll split up the videos so that they're not all in one, and so we're going to be talking about back pain, plantar fasciitis,
tennis elbow,
good,
and knee osteoarthritis.
Lovely, see, she's a pro already. So Rachel, what we may start with is tennis elbow, good. So guys, tennis elbow, for those of you who may not know, it doesn't necessarily have to come from playing tennis, obviously, but the common repetitive movements of this can develop into something called tennis elbow, and it's an easy way to know. You probably see a lot of this in the kind of line of work that you should do.
Yeah, it's a very common condition.
Okay.
Lots of people get it, and like you said, from the repetitive movements.
Okay.
Signs and symptoms of it, you might get a little bit of pain and kind of a dull kind of achy pain in the kind of outside of your elbow there.
Okay.
Again, like you said, it doesn't have to come from playing tennis. It can be from just doing lifting or repetitive movements or having your arm in an uncomfortable position.
And is it dangerous as such, having tennis elbow? I mean, could I sit there and say, look, don't worry about it, or is it something that needs attention?
No, it's definitely not dangerous, but it's to do with your quality of life. No one likes to be in pain.
Okay.
So there are definitely things we can do about it, yes.
Okay. Is there a way of kind of telling? I mean, we don't want to obviously self-diagnose, but I think sometimes some of my patients, they kind of have the idea, oh, this is tennis elbow. But is there a trick maybe we could kind of learn to...
Sure,
to know?
I can do it with you now.
Oh, lovely.
So let's say if I put you put your hand out like that.
Great.
And I'm just going to push down against your finger.
Okay.
So whilst Lavan is trying to raise his middle finger, I'm pushing against him.
Oh, right, yeah.
And do you feel any pain?
I don't feel any pain, but I can definitely feel some resistance on that outer side.
So if you were to feel pain whilst pushing upwards with your fingers against someone else resisted, it might be a sign that you have a bit of tennis elbow going on.
So what do we do about it?
Right, so there are two stages to our management. Initially, we just want to stop the actions or modify, let's say, the actions that are causing us pain. So if you're getting pain when you're lifting heavy objects, try and limit the heavy objects you're lifting. You may need to talk to your employer or something like that about modifying your work if necessary.
Okay.
So initially we want to try and rest it. If you've had the pain for a couple of days or a week, just try and rest it as much as possible. You can put a bit of ice on the area or a cold compress. Ice it for about 20 minutes, a couple of times a day, just to help reduce that inflammation and settle the pain a little bit. Some people do find though that the pain can go on for a couple of months.
Okay.
And this is when we say it's become kind of a chronic issue.
Okay.
This is when we need to kind of stop resting it and we actually need to take charge of the pain. Now, the tendons we have in our body are actually very lazy things. Once we rest them too much, they become a little bit lazy, and then that's what gives us pain when we move. The treatment for a tennis elbow that you've had for kind of months and months would actually be some strengthening exercises. So the stronger you can make the muscles and the tendons in the elbow, the better, okay?
Okay.
And then we can go through those exercises. So at home, there's lots of different ways you can help your own pain you get with your tennis elbow. What I recommend to patients is getting a can of beans. Unfortunately, we don't have a can of beans or soup with us right now, but that's a good weight to use for the following exercises I'm going to show you. So Danielle, if I give you the weight, the first one we're going to do is a bicep curl. So you just bend your elbow and relax. That's the first exercise we can do, and if we did 10 of those and 3 sets, that would be a good starting point. So the next exercise, again with your can of beans or can of soup, you're just going to be flexing the wrist and bring it back down and bring it up and down with that can of beans. Again, if you can do that 10 times, do 3 sets of that, that's a good start to helping a tennis elbow. Finally, again with our can of beans or can of soup, we're going to flip our hand over the other way and just do this motion, sort of like you're revving a motorbike, gently backwards and forwards. It's important to do exercises slowly and good with technique rather than rushing through them.